Welcome everyone to today's webinar. I am Mackenzie Bean with Becker's ASC Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Marilyn Danai is the Director of Payer and Reimbursement Strategy for Cardinal Health. Marilyn is a subject matter expert on health policy, payer, and reimbursement strategy for Cardinal Health. She is responsible for education, resources, analytics for health policy strategy, health economics, reimbursement, market access, and payer strategy. Marilyn is a sought-after industry speaker on evolving trends and an educator on healthcare and payer contracting and strategy. With more than 25 years of experience in the healthcare arena, Marilyn has worked in hospital administration, practice management, healthcare contracting, and network development. She has spearheaded reimbursement and payer strategy initiatives and consulted in such areas as pharmacy, medical devices, durable medical equipment, and emerging technologies. In particular, Marilyn focuses on reimbursement and product commercialization services that strategize on opportunities to leverage the life cycle of medical technologies. She is successful in obtaining medical policy, payer initiatives, and beta projects for economic analysis for product adoption. And Marilyn, I'll now turn the floor over to you.
Good afternoon, everyone. I'm pleased that you're able to join us today. I'm going to first review our objectives for today's discussion. Today, changes in the healthcare and reimbursement landscape are creating new opportunities for ambulatory surgery centers to improve on your financial performance while supporting safety and quality of patient care. In the next few minutes, we're going to discuss how to successfully navigate this changing and challenging environment. In particular, we'll oversee the factors that are converging to create a new window of opportunity for the ASCs. These factors include the rise of alternative payment models such as value-based purchasing and shared savings, a shifting focus on payer mix and patient demographics, and the expansion of Medicaid and managed care. So just to highlight what some of the objectives are, we're going to discuss how industry-wide healthcare and reimbursement trends impact the ASC. I'm going to describe why the ASC should focus on commercial payers for contracting opportunities, and I'd like to also identify reimbursement factors in a value-based contract and explain the ASC value-based readiness assessment, which will really be critical for your success. As we move through the outline, I'll also discuss some of the rudiments of success for the ASC today. I'd like to mention that about Cardinal Health, we have more than 40 years of experience, recognized as a leader with a top ranking for transforming healthcare supply chain to meet new challenges around cost, revenues, and outcomes. The healthcare industry today is in the midst of significant change that is happening right now. We're seeing a change from volume to value. We're moving from a health-centric to a patient-centric environment. And our population is living longer with many complex diseases. In all, this propels healthcare providers into uncharted waters. As we move into healthcare trends that are projected to 2020, I'd like to share with you about the increasing demand driven by shifting demographics. We see an aging population. We see them with more complex diseases, as I've mentioned before. We see government coverage increases with a change leaning toward commercial coverage declines. We also see pricing pressures, especially toward targeted therapeutics. We also see provider consolidation, which is creating scale players like within the ACOs and the bundle payment arrangements. We also see integrated risk-taking providers, leading shift from a fee-to-service to a new payment model. We'll also see that sites of care are shifting actually to lower acuity settings, like the ASC, which is a great opportunity. There's a great interest in consumerism, and that we'll discuss as we move forward through the presentation, and how that is actually impacting the trends moving forward to 2020. The other, just a highlight, is technology and data is placing a critical role. It tells a story. It is something very concrete and very tangible, and so it's very critical to put this in the mix that's going to move forward in the upcoming trends. Additional trends as we move into the ASC is that we're seeing small practice mergers and acquisitions, which are increasing. We see a rise in minimally invasive surgery for the ASC market, and that is also due to the lower risk for complications, as well as reduced hospital stays and lower cost. We'll also see opportunities in cardiac surgery because of that large segment growing with a number of procedures, especially with minimally invasive areas. We'll also see that reimbursement is declining in the ASC, which means we have to think very carefully and strategically as the ASC faces competitions from the hospitals and other outpatient facilities. And the biggest challenge is the increase in bad debt. As I had mentioned earlier about consumerism, because of the high deductibles and high premiums, consumers have to be very savvy shoppers on their healthcare dollars being spent. But the challenge is that if they have an emergency, they have this high deductible to be met, and it becomes a challenge with the ASC. One of the things that I would recommend with the ASC is what has happened in a lot of large practices that are doing outpatient centers, and they're looking at credit terms like with Care Credit or Greenway as a way to minimize their direct liability by having their patients actually contract directly for healthcare credit card services. Some of the areas that are probably the most attractive moving into 2020 are going to be in orthopedics. You're going to be competing, especially, I believe it is an opportunity with the CJR, which is a joint placement bundle arrangement. Right now they're doing it as an inpatient, but I believe that as procedures are perfected and as people are looking at how to minimize cost, improve delivery of care, that orthopedics could actually be, especially with joint replacement, an opportunity in the ASC. You'll also see it in neurosurgery, urology, ophthalmology has been in the ASC for some time, but you're going to see an expansion of services in that area as well. You'll also see an area of general surgery and an ENT. So keep this in mind that if these are procedures you have not considered, it might be something for you to take a deeper dive in. One of the considerations is actually to bring higher acuity cases to the ASC. So one of the things that you're going to actually be looking at is the opportunity to actually partner with your physicians and hospitals for market access and for patient being driven to your centers when you've looked at specializing certain procedures in your market. The other is, in addition, is that think of ahead of the times and maintain a high quality standard and a great staff is actually a great way for it to be successful and leverage your center. What I'd like to share with you is that you'll see that these are the statistics on the ASC payer mix. And you'll notice that what's highlighted here is actually on the commercial payer. Commercial payer is where you're actually your finances or revenue are being driven with your gross charges, your percentage of collections, and your percentage of cases. While understanding the most attractive ASC specialties, it's also important to understand what your payer mix is. Now let's shift our attention to another area of major change in healthcare. The next era of healthcare reform, and I would like to, the reason I'd like to share with this with you is that this is in the horizon right now. And one of the 4 key principles that they've talked about on the healthcare reform is what the GOP would like to consider to be their 4 key principles. Now, we know that there's already a bill signed and it's gone to the Senate, but the ink is not dry. But these 4 principles are to reduce federal entitlement spending, to devolve health policy to the control of the states, because they feel that this would actually reduce the federal role in healthcare and provide the states with more autonomy, decision-making, cost-cutting, as well as oversight in the delivery of cost and care within that market, those markets. They'd also like to embrace more free markets and consumer choice. They believe that actually what they've seen over the last 8 years is that the private sector competition with payers has been diminished, and that's the reason for the high premiums and the contraction in the marketplace. So they'd like to see this actually modified. The other is transparency of the cost and quality. Going back to consumerism, that consumer choice is going to be very important, especially with, in fact, those high deductibles, which they'd like to see also modified. Next slide, please. So on the health policy outlook, as you probably have heard, but I'm going to actually just point this out to you as well, is they'd like to repeal and replace the ASC because, in fact, it hasn't been working as well as they would have liked. They'd like to expand on interoperability and interportability for those who travel, because we're so global, we're so mobile today. The other is, as mentioned, is Medicaid expansion. We realize, in fact, that there is a pocket in the population that, in fact, are uninsured. But there are also those who qualify with the Medicaid programs that they'd like to see revised and modified, and that the states would actually have more oversight to manage those cares and costs, as I mentioned earlier. Drug pricing policies. This actually came up this week. There are 3 bills that came up before Congress this week on the drug pricing policies to try to control costs, modify what's coming over the border from Canada, and that to make the drugs more available and affordable to Americans, and especially through Medicaid, Medicare, and commercial insurance. They'd also like to see a redistribution and refunding of the Medicare and Medicaid programs, very much those Medicaid managed care and Medicare managed care organizations. They found that they're actually managing care and costs really well. So they'd like to see more of a shift to those types of organizations that manage those populations. We know that MACRA is a requirement, but they're requesting that it be eased for 2018 because there are so many risks and penalties involved with this, especially for providers, that there's a lot of lobbying efforts in this area. In addition, on the mandated programs, they'd like to get rid of some of the mandated programs, and I'll put that in parentheses. They'd like to see more creativity. This is coming through the Healthcare Land Network with alternative payment models, and they'd like to see some creative type of alternative models and delivery of care, especially for complex diseases. So we'll talk a little bit more about this. And also on the horizon, if you'll notice, is they would like to repeal, that is written to the new bill, the medical device tax, the Cadillac tax, and the health insurance tax. Now, the one thing that's not on here, but it is an amendment in the current bill, is in fact the pre-existing clause. We know that's a must, and so that is in the bill that's gone before the Senate. Now, realize what the Senate is going to do is they're going to peel back that onion. They're going to have their agenda. They're going to hopefully keep some of the finer elements of what's been proposed by the House, and with time and effort that they'll come together with a successful package for the American people. Next slide. Now, one of the challenges in the ASC that I'd like to talk about is healthcare costs outpace commercial and government reimbursements rates. And as high deductible health plans became more the norm rather than the exception, many hospitals have found that their revenue cycle infrastructures have sprung unexpected leaks. So for insured patients, we see that in fact it's over, bad debt has been over 30% each year for some hospitals. I had a meeting with one hospital and it was close to $1 billion in bad debt due to high deductibles and uninsured care. So this is a real challenge when you're trying to manage care and cost. The other, as I mentioned about the high deductibles, this is a real challenge, and it's quite difficult. So we're seeing the care for those with these high deductibles, it's more challenging, more expensive, and for the hospital, it's also expensive and it's hard to collect. It's also hard to write off. The other is, of course, the high rise of premiums. We've seen it from 13 to 51%, but we know, like Arizona, I think it's at 118% is the premium dollar, and they only have one insurer in their market. Next slide. The other is that you're going to see, as I had mentioned already, the bad debt and charity rates rising, and this is where the thought is if Medicaid expands into the states, is that there might be more control and cost and care and putting more preventable programs in place. And you're probably not aware of it. Most folks aren't. And each state has a health assessment, and they go by county and they drill down to this and they decide what the most challenging disease states are and how they can manage care and cost and how they can actually make it available for access to care, especially in the rural markets. And so they'd like to be able to change some of this dynamic. The other is that I've already mentioned to you about patient collections and that the self-pay patients challenge with the bad debt. So we can go to the next slide. What I'd like for you to see here is that this is why the reimbursement assessment is so critical. That one of the areas that's so critical is that the building blocks of coding, coverage, and payment in that reimbursement assessment is so important in understanding what the reimbursement landscape is. And that's because there's so many factors that actually feed into this. We have where it links into reimbursement systems, coding, and the coverage issues, and that comes from the federal government, commercial insurance, from Medicaid programs, there's different coverage issues that commercial payer might be having a positive policy, a medical policy, but you might see in Medicare with the local coverage decisions that in fact it's not the same, and that there's work to be done in actually to get coverage or approval for that Medicare population. It goes back to understanding what your payer mix is as well. Now you'll also see that the payer coverage also in utilization management is very critical because that actually links into your healthcare economics and your market strategy. And then you're going to look at what your value proposition is, your cost benefit are. So important, as I can't highlight enough, understanding the current reimbursement landscape for the products and services and procedures that you're delivering are very critical, and understanding all of these elements and applying them. Now, as the ASC is in transition, we know that it's important with this transition to meet the challenges of the new healthcare world. We see that the transition from fee-for-service reimbursement to one based on value is one of the greatest financial challenges an ASC currently faces. Providers are not only shifting to shared value, they're shifting to shared risk. Those who can't achieve that the required scores will face financial penalties and lower reimbursements. And you're already facing that in the ASC. This is why providers are focused on broad-ranging clinical, financial, and operational improvements. In particular, I'd like to mention there's a heightened focus on succeeding with alternative payment models such as value-based purchasing and risk-sharing payment models. At the same time, the ASCs are striving to say at healthcare reform, there's the ever-present need to support safety, quality for patient care. Now, health transformation is shifting toward value-based outcomes, which I've mentioned. And we see within this wheel and the spectrum of the complexities of all that actually filters in for sustainable healthcare. We see that in order for the healthcare environment, there are several forces that are impacting providers, changing the way they operate and deliver care. And these forces combine to create unsustainable healthcare expenditures, a variation in care delivery, and the prevalence of preventable and chronic conditions. These forces also create new opportunities for shared savings and improved and value-based outcomes. Now, I'd like to just highlight this model, that the value payment model takes many forms, and I'm not going to take a deeper dive today, but you'll notice that in the lower left of this illustration, the traditional fee-for-service model requires little need for coordinated care, and the provider takes little financial risk. In the upper right, you see the exact opposite, a global capitation model in which the need for care coordination is high, and the provider takes full financial risk. In between, you can see a number of variations, including shared savings and bundle payment models. Indeed, the shift from fee-for-service to value-based contracting is real and is happening right now. Now, I'd like you to take a closer look. Next slide. What we have is the emerging payment models that we are discussing truly call old imperatives into question. So you see the accountable payment models here. One way to evaluate the accountable payment model is to view them through three lenses. We see cost of care, which is bundle pricing. It was a bundle pricing model. We see the quality care in the center, which overlaps, and that's for pay-per-performance models. And then on your far right, the volume of care, which are shared savings models. As you can see here, the risk is weighed toward performance with the bundle pricing model and more toward utilization in the shared savings model. The pay-per-performance model is more equally weighted between performance and utilization risk. Now let's take a closer look at the contracting models available today. So we have performance-based, which targets quality metrics. We have patient-centered medical homes, which are partnerships between patients and providers, and it really doesn't target the ASC. But we do have bundled and episodic payments, where there's single payments for a single episode of care, which actually gives an opportunity to the ASC. We also see risk-based competition, population care based on achieving targets, another area for ASCs. We have defined networks, which payers place providers in tiered or narrow networks. There's an opportunity here in the ASC if you haven't thought about it, and that is in fact with your employer groups and their relationships with payers. And as hospitals, employer groups, and payers are now working cohesively in some markets and trying to find out how in fact if they have a large employee population, how to channel, manage, and direct care. So that could be an opportunity there. And then centers of excellence. I want to mention this, that this is, of course, high quality and cost efficient providers contract with payers. Many times this is, you'll hear of centers of excellence like for bariatric surgery or for cardiac care. But you know what? An ASC might have that opportunity. If you have a specialty like in ophthalmology and eye care and you can meet the requirements, I believe that's an area of opportunity for you. Now, as we move from shift from fee-for-service to value-based contracting, I'd like to mention to you why value is actually highlighted here. It seems very intrinsic, but it is generally understood to be defined in healthcare as a result of quality divided by cost or health outcomes to achieve per dollar spent. So there really is a formula involved in this. So it's not that someone used a lovely adjective to say this is what we'd like to add into healthcare. There is actually some thought behind it, and it's really quite definitive. So as we move forward, especially as we move from value-based purchasing to value-based contracting, one of the areas that CMS has looked at for payment arrangements is exactly what those alternative payment models components would be, and that was to include this formula. Now, national payers are also beginning to move to position themselves into shared risk arrangements. Historically, they did this first. They looked at shared risk arrangements. They had capitation programs. They were doing preventive care and other arrangements with the employer groups and within communities that were high risk and chronic disease states. So they were already driving results. They were improving delivery and quality, and they were already doing it at a lower cost of care. The challenge is that with the Affordable Care Act, that was taken away from them. And that shift more to a government program has actually sent that pendulum back, looking at the national payers to do this. And the key to the reason they sent this back to them is that national payers have the technology and data to look at the patients at risk, look at claim data, be a true partner in it, and then have discharge planners, case managers, and other resources to actually work on a multidisciplinary approach in looking at disease states and how they can manage shared risk arrangements. Now, when you're developing your contract strategy and plan, I want to mention that I do believe there must be a meaningful and collaborative dialogue with the desired payers. It needs to be a win-win approach because it's a long-term relationship, and you want to be able to go back to the table and be able to modify your contracts and modify your reimbursement. So it can't be, I don't believe it should be adversarial. I believe you have to be open-minded, but we're going to talk a little bit more about that as we move through the presentation. I'd like to talk to you about the opportunities for the ASC with the value-based contracting. One of the value-based contracting involves reimbursement based on indicators of value. So we look at patient health outcomes, efficiency, and quality. And with the alternative payment methodology, we generally look at a portion of the provider's potential tied to the following factors. And I'll just highlight a few. We look at the provider's performance on cost efficiency, quality, pay fee for service for a bonus for reaching a target, processes that change the way that it is delivered. Quality measurements are very important. This happens not only in the hospital setting and outpatient setting, but there's opportunities here for the ASC to actually apply this. So keep this in mind. This is an area I think many times is overlooked in the ASC. The other is efficiency standards. What you want to do when looking at this value-based contracting is taking these elements and seeing how you can leverage them, see how you can improve your performance so that in fact when you go to meet with a provider, you're actually ahead of the curve. You're ahead of the game and showing in fact your potential to be a good partner in the delivery of care. Next slide. Now, I had mentioned to you about the objectives that we had, and this to me is very critical when you're going to move into value-based contracting. This is a readiness assessment, and I'm not going to go over all of it but in detail because of time, but I'd like to highlight a few areas with you. Now, you'll notice in the center of the ring, or rather on the outskirts of the ring, apologies, that there are areas here I would like to highlight. You want to look at your care delivery transformation, and this includes a strong coordination with patient engagement. As we move to the next pie in the chart, we look at robust technology. I can't stress enough how important this is in your assessment. Data tells a picture. It's not something fabricated. It's very definitive. You see what your gaps are, and it allows you to report your performance. It also gives you an opportunity to improve your performance. Now, comprehensive provider networks, very important here. It's because performance expectations and measurements are within your provider compensation alignment as we move to the spectrum. So you're going to have to understand what your plan and design, your structure is, your governance and your administration. Very important. Then, in fact, what are the payment models that are going to be the most effective for you? I had mentioned to you about the payer-employer collaboration. I want to just highlight this. Everyone will projects that it's the payer that dictates what they will and will not do with new technology or access. But in fact, the employer collaboration with the payer is there due to a fiduciary duty. And that means, in fact, that because the employer is, in fact, paying that per patient per month to the payer to represent and contract with them, with their hospitals, physicians, and ancillaries, there's an opportunity with the ASC to understand that dynamic and understand, in fact, how you'd like to be part of their collaboration. You also want to understand what type of risk-sharing arrangements are being made with your ACOs, your bundle payment care initiatives, sometimes your multi-specialty groups in your area. And if you're just thinking of actually having a specialty in your marketplace, this is very important where your collaboration idea should be here to see where you could leverage your ASC. The other, and finally, is your strong organizational foundation. You have to have a supportive culture. You have to have your mission statement, your goals, your strategy in place. You need to have your financial strength in place, and you have to have committed leadership. And that's not just physicians, that's everyone who is in part of your organization needs to help to support so that, in fact, you can move forward with your strategies. Next slide. Next, I'm going to talk to you about negotiating the value-based contracting. On the next slide, we're going to talk about the relationship of a value-based contract, why it should be long or short, and it should be very long-term. Something happened here? Okay. I want you to look beyond the rates. I want to look if you're out of network versus in-network strategy. Very important. These are just some of the bullets that I want you to keep in mind. Healthcare reform implications. This will also impact the ASC. Review outdated reimbursement methodologies, alternative payment models in your risk sharing, see if it's something you're considering, and how to manage your risk while reducing cost of care and maintaining high quality. The single most important thing an ASC center should do on managing your contracting today is to partner with your payer to identify the opportunities to provide surgical services on high-cost cases, where the ASC can prove to the payer via data and a solid business case that it can offer a savings to both the payer and the patient. I'd like you to keep in mind that quality, cost of savings, and patient outcomes are critical. Hospital and healthcare systems and payers collaborating on accountable care organizations is very important. You're seeing more of these arrangements because they need the collaboration, not only the multidisciplinary approach, but because this is such a challenging market and those margins are so tight that it's critical to understand what that alignment is and how you would actually support that. Now, one of the things that I'd like to mention too is about single case versus carve-out arrangements. Many times in the ASC contract arrangements that this has been an area where you haven't done your homework, because you might be paid for a single case, but you might have some new technology, an implant, something new on the horizon. I often suggest or recommend that you have carve-out arrangements on your agreements that help to minimize your risk and out-of-pocket cost. The other is include in your contracts evidence-based negotiations and criteria. And the root of this is actually data. I can't stress it enough. It's important. And then exhibit indispensable value. That's the true key to successful rate negotiations. And although the reimbursement model is the most significant area of the contract, procedural requirements can be onerous and even deal breakers. And following your contractual elements as areas to which hospitals and physicians should pay attention to. And that would be through authorization process for treatment, period specified for submitting claims, period allowed to appeal or deny a claim, requirements regarding use of an oral or injectable drug, time specified for a timely payment, processes for adding new service lines or adding new physicians to your plan, and then of course, period required for providing notice of modification proposals, and then have a cancellation clause, including the advance notice required. So these are some of the imperatives that I know that sounds like a laundry list, but they're important elements for your success. And I'd just like to highlight the rudiments for success that I've put together. And these are, in fact, due to the changing and challenging environments that we're living in today. And one, as I highlight, look at your contract strategies. Prepare for population health so that you have the appropriate utilization. Pursue your consumers, understand their pain points, come up with solutions, because that's what's going to drive your business. Also, consolidate the systems and assets to improve interoperability. Very important. That's actually a part of the healthcare reform bill. Distribute your inventory portfolio to widen access. You need to market yourself. You need to become, not only are you going to leverage what you are, you want to be known in your community of how you offer quality and value and an area of expertise to expand your access. You want to understand too that sometimes you need to just standardize your care delivery because that reduces your cost variation. So sometimes you can't be everything to everybody. You have to pick something and do it really well. Personalize your care to retain your patients. You know, hospitality means a great deal. At one time, hospitals even considered how important it was to incorporate that customer care, that special touch that leaves quite a positive impression, especially when you're going through the healthcare system. The other, as I had mentioned, is high IT infrastructure and analytics, and there are many tools out there for you to leverage to tell your story. And then can't stress enough, keep a pulse on healthcare reform. It does have such a cause and effect on what we do as we move forward. In conclusion, I'd like to just mention to you, as you focus on developing scalable solutions for your own ASC, there are 3 opportunities to focus on. Seek ways to improve your financial performance by reducing your expenses, realizing revenue and other strategies. Stay ahead of healthcare reform, and I've bulleted some areas to highlight the importance in there. And one way is to actually explore your alternative payment model opportunities. I believe there's a great deal there for the ASC. And in conclusion, support safety and quality of patient care. Offer quality performance and measurements because that helps you to tell your story. Promote good outcomes and solutions through the continuum of care. And I know that each and every one of you will be successful. Thank you.
Thank you, Marilyn, for that fantastic presentation. Before we start with the question and answer section of today's presentation, we did want to let you know of Cardinal Health's new LinkedIn group specifically for ASCs. The group is called Ambulatory Surgery Center Excellence by Cardinal Health, and I've included a link to join in the chat function on your control panel. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. So the first question is, what opportunities can I leverage to increase the reimbursement for my ASC?
That's a very good question. One is my recommendation is moving cases from the hospital to the ASC. You want to leverage your relationship with your payer. This is very important. You might want to do an analysis in your area and even within your group, because it goes back to that payer mix, and look at, in fact, what payers you have the most patients being driven to you, and in addition, decide who your employer groups are. It's actually looking at network development or access. But the payer relies on the ASC to help them accomplish their goal of providing quality care at a lower out-of-pocket cost for its members. If your ASC is equipped to take on a larger acuity case, this can put you in a strong position to obtain higher ASC reimbursement. And I recommend develop arrangements with physicians, including your ACOs, to leverage special case or rate arrangements and secure market access to drive patients to your ASC.
Great, I think that's helpful for our audience to know. Thanks, Marilyn. The next question refers back to your mention of commercial being the highest percentage of the payer mix. This audience member wants to know, what if I'm already maximizing the reimbursement on my commercial contracts?
Well, the first thing I would say is to make sure you're truly maximizing your commercial reimbursement. You can never be too sure that you are implementing all the right steps to achieve this. I would suggest asking yourself a couple of verifying questions. Have you carefully looked over how your commercial payers are reimbursing your ASC? You need to actually have them on the list. You compare them by procedure, and then you'll actually see this in a black and white. It won't be an assumption. It's actually very tangible for you to review. The other is have a payer contracting professional evaluate your opportunities. Right, that would be my initial recommendations.
Thank you for clarifying. Those are great points, Marilyn. So the next audience member wants to know, why is value-based payment models and contracting an important consideration for the ASCs?
Well, the landscape is shifting under the U.S. healthcare industry. And with the volume to value transformation put in place by Medicare Access and CHIP reauthorization, that's MACRA, I mentioned it briefly about the healthcare reform, is that traditional fee-for-service payments are being replaced with a financial incentive framework that rewards for improved quality, outcomes, and cost. Now, this shift to value-based reimbursement models creates a new paradigm in which care is delivered by an entire coordinated care community sharing in that responsibility and the risk. So outcomes and cost are in that mix and touching almost every part of the healthcare delivery operation. Now, ultimately, value-based payments transform traditional business models by putting significant revenue and risk at stake. Building the outcomes-based financial models and data infrastructure to maximize those value-based care reimbursement pathways will be fundamental to sustained growth in the future. The healthcare players left standing strong will likely be the ones that strategically embrace change, starting now to understand the impact of MACRA and the new value-based payment models to their organizations. So you need to customize the broad array of value-focused shared savings, I can't stress that enough, shared risk and bundle payment models that will work for your individual situation, and especially the populations in your market.
Great. Thank you for pointing that out, Marilyn. It looks like we have time for one more question. And this audience member is interested in the strategy behind negotiating managed care contracts, and they want to know what would be the first step or recommendation to negotiate these contracts.
The first thought that comes to mind is this. ASCs must have a strategy. They understand and plan for change with their payers, physicians, and patients. They have to know their strengths, weaknesses, opportunities, and threats. That SWOT analysis is very critical. It's a great way of taking an inventory. And in conclusion, I would say be prepared. Be very prepared and do your homework. Know how to collaborate, know how to compromise, because remember, this is a win-win. And don't be short-sighted. You're there for the long run.
I think that's great advice. Thank you again, Marilyn.
Thank you.
That is all the time we have for today. I want to thank Marilyn for her excellent presentation and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.